Hi, this is Dr. Dave Cron, and welcome back to Dairy Sense. Today we're going to talk about the biggest negative effect of oxidative stress, and that is hypocalcemia. We're going to go through the causes and the prevention and treatments for this devastating disease on all farms. So let's go through the causes of hypocalcemia. So where does hypocalcemia come from? As we talked about in the earlier videos, it comes from oxidative stress. And when we get oxidative stress, we get these metabolic toxins that causes the intercellular adhesions to break down, and you get a condition called leaky gut. And this leaky gut causes the release of bacteria and toxin, especially the toxin named LPS. And this LPS toxin causes the activation of the immune system. So there's two things that happen to an activated immune system. One, they become glucose utilizers. So in a fresh cow, when they use up the glucose, the cow gets ketosis, and which leads to fatty liver. In a lactating cow, the decreased glucose causes a decrease in milk production. So the second thing that happens to an activated immune system is they become calcium utilizers. So you get decreasing calcium, which causes a condition called hypocalcemia. And when this occurs, the cow's extremities or their ears get cold, and you have decreased gut motility, which is really critical. So in a fresh cow, this causes a thing called milk fever or hypocalcemia. But in a lactating cow, it causes a condition called mid-lactation indigestion, or a lot of people call it mid-lactation milk fever. So let's first of all look at hypocalcemia in fresh cows. And we'll go through how we prevent hypocalcemia and how we treat hypocalcemia. So the first one is, how do we prevent hypocalcemia in fresh cows? First of all, we continue to feed anionic salts or the positive charge binder called zeolite to our pre-fresh cows like we normally do. But the biggest thing is we need to maximize dry matter intake in the pre-fresh, preventing mobilization of fat, which leads to mobilization of NEFA. And when this occurs, you get oxidative stress, leading to oxidative stress in cows. So how do we maximize dry matter intake? It's the common things that we've all learned. And first of all, it's cow comfort. We need 30 inches of bunk space per cow. We need a well-balanced diet meeting the metabolizable protein and metabolizable energy requirements. We need enough effective and digestible fiber. We need to prevent sorting, and we need to keep the low amount of rapidly degradable starch. We can't have too much rapidly degradable starch in these rations. And then we need to keep feed in front of the cows 24/7. So now that we went through the prevention, how do we treat hypocalcemia in fresh cows? First of all, we do not focus on calcium products only as treatment, because in order to get hypocalcemia, you get oxidative stress, and oxidative stress causes a lot of nutritional deficiencies, and they are listed below. First one is low magnesium, which is super important, along with low calcium, low potassium, low glucose, low phosphorus, and sometimes some of these cows just need some prayer. So on day one, if a cow is standing and has cold ears, we need to give them a calcium bolus. But if she's down and wobbly, we need to give her an IV of calcium mixture of calcium and magnesium. We do not just use calcium alone. I use a product called CMPK. It's got calcium and magnesium in it. That's really only two things that are important. And again, you do not use straight calcium gluconate on these cows. So in day two, we need the appetite score. And we appetite score 1 to 3. 1 and 2 is poor appetite, so 3 is good. When we have a cow that has a 1 or a 2, we need to drench them with a mix containing the following: calcium propionate, which has got calcium and glucose in; magnesium sulfate, which has got magnesium in; potassium chloride, which has got potassium in; and monosodium phosphorus, which has got phosphorus in. We mix this in 10 to 12 gallons of warm water, and we drench this to the cow. We drench these cows once a day until their appetite score is 3. We only IV with CMPK if they are not responding to the drench. And again, I want to repeat, do not give propylene glycol only. That only gives the cow glucose, and so they're deficient in all the other things we talked about. So let's go through hypocalcemia in lactating cows. How we prevent hypocalcemia in lactating cows and treat. So what does hypocalcemia look like in a lactating cow? Like we talked about before, it's a condition called mid-lactation indigestion or mid-lactation milk fever. This is the most prevalent disease on all farms on a daily basis. We see this every day on the farm. Cows have stiff manure and cold ears, and they range in a few hours of decreased ruminations to a cow totally off feed. So when we have our rumination collars or tags, when we look at our list of cows overnight, when we see the cows that decreased ruminations, this is the reason why they went off of ruminations. So how do we prevent hypocalcemia? We prevent in lactating cows. We prevent it by reducing SARA or subacute rumen acidosis or rumen acidosis. Acidosis causes oxidative stress, and so we want to avoid that. How do we avoid that? We reduce overcrowding, we reduce sorting, we reduce slug feeding, especially with overcrowded cows. They will slug feed. We need to make sure we don't have empty bunk syndrome. We need to make sure we have enough push-ups throughout the day and night. And we need to make sure we have enough effective fiber in our diets, and try to always avoid high moisture shelled corn because it's rapidly degradable starch and lowers rumen pH. So how do we treat hypocalcemia in lactating cows? Ideally, we IV with a product called AminoCal or aminocalcilite forte. It provides calcium and also amino acids. Amino acids are important because they help in supporting the enzymes that reduce oxidative stress. If the supplier is out of the product above, we need to IV with CMPK. This usually only requires one IV. In severe cases, you might have to IV them the next day. This is all that we need to do to treat these off-feed mid-lactation cows. We don't need to give any pills, no probiotics, no oral drenches, just an IV. To wrap things up, hypocalcemia is the most negative effect of oxidative stress on all farms on a daily basis. We see it in fresh cows, we see it in mid-lactation cows. Hopefully this video will help you identify these issues that we see with hypocalcemia and learn how to prevent and treat them.